Magandang araw po muli. Magandang araw mga classmate, magandang araw Doc sa ating mga tagapakinig. Pagpapatuloy po natin ang ating pag-aaral sa blood. Number 7 na po tayo, sweat. So, ito po napakahalagang malaman natin ano yung normal tongue. So, ang normal po sa tingnan natin sa body muna, body color, pale red. Hindi po siya masyadong mapula. Pale red siya, ayan po. Para malapit sa pinkish. Yung body shape po, ang normal, hindi po siya manipis, not thin, hindi siya maga, not swollen, not stiff, hindi matigas, not flabby, hindi masyadong makapal. Tapos dapat walang crack. Yun po yung normal shape ng tongue. Yung coating naman po, yung normal, katamtaman po yung yung balot, thin, tapos medyo white ng konti. Hindi siya yellowish, hindi rin masyadong white. So, katamtaman yung kulay. Yung moisture naman po is slightly moist. Yung shen po ng dila, so pag tiningnan po natin with shen, ibig sabihin nito, fresh. Ayan. Radiant and brilliant. So makikita natin yung buhay na dila. Okay. So, yung topography po ng tongue, yan, pag titingnan natin, yung taas pong bahagi, doon natin nakikita ang lower burner. Ano ba yung nakapaloob sa lower burner? So, mamaya po natin makita. Nakadetail yata doon. Tapos, middle burner at saka upper burner. Okay. So, yung lungs po, yung heart muna, yung tip. Andun po yung heart. Kaya pag nakita natin kung ano ang nasa tip ng dila, heart organ po yung makikita. Yung kasunod is lungs. Okay. Yan. Yung heart tip po, ayun, sa first drawing, red ano. Ito naman, yung liver side niya, yung mga tongue areas. Yung liver side, yun po yung sa liver, yung padalawang gilid. Liver and heart, side and tip. So pag liver pa ang titingnan natin, tsaka heart, so yung dalawang gilid ng dila at saka yung tip. Kung titingnan naman po natin ang stomach, ay ito yung nasa gitna. Yan. So stomach and spleen, side in central section. Yan po yung gitna, no? Pag lungs naman po, front third. Nakita natin kanina dun sa may guhit. So, ano ba ang ibig sabihin pag pale and thin ang tongues? So, ibig sabihin po nito, lack of blood and body fluids causes decline in volume of tongue body, thinning, shrinking, contracting of tongue body. Yan. So, depending on individual's constitution or life circumstance, Spleen Qi deficiency may lead either to accumulation of dampness or lack of blood. Both are secondary aspect of disharmony of spleen Qi. Yun po natin nakikita pag pale. Pag long-term deficiency naman po, pag yung matagal na may nararamdaman, so ang nangyayari po na impaired ang transformation of food into blood. Because of this, every pale tongue reflects elements of blood deficiency. So basta't makakita po tayo ng maputlang dila, nagre-reflect po yan ng kakulangan ng dugo. So when blood deficiency contribute to illness, so pale and thin tongue body. Pale and dry. Pag women po o suffer from profuse menstrual bleeding, pwede rin po yung breastfeed or long period of time. Follow improper dietary habits. Nagiging pale and dry ang tongue. Pag thin naman po, pale, tongue, manipis at saka maputla. Maaari pong suffer from lack of blood, yung kulang po ng dugo. So kung hindi po ito nagagamot, nagkakaroon ng kidney yin deficiency. Tapos magiging pong may develop blood nourishes yin. Then, development of kidney yin deficiency is visible when pale tongue body changes its shapes or takes on intense red or orange tinge. So, yun po yung nangyayari kung hindi nagagamot. If pale tongue is dry, pathology is not so severe. Baka
Ako po, Doc. If pale tongue is dry, pathology is not so severe. Like blood has lost its moistening function, but deficiency is not yet significant. Typical symptoms of blood deficiency are dry or itchy skin, hair loss, pale tinge to skin, then numbness in extremities and dizziness. Now we have here a patient, male, 41 years old. Ang tongue description po niya ay pale red, slightly thin, rolled up edges, slight depression at root, and then patients presented symptoms of deep exhaustion, depression, and backache. Western diagnosis? None. Background to disease are overwork, hectic lifestyle, emotional problems, excessive sexual activity. And then TCM diagnosis, slight spleen Qi deficiency with blood deficiency, and then liver Qi constraint and slight essence deficiency. Okay? Yan lang po. Thank you so much for listening.
Yeah, thank you very much. We continue with tongue diagnosis. Let's welcome again Ma'am Teresita Sumilen. Good afternoon po, Ma'am Teresita.
Good afternoon po, Dr. Hector and classmates. Welcome po sa tongue diagnosis. Now let's talk about the normal tongue. The normal tongue reflects energetic harmony within the body. The right interplay of yin and yang, qi, blood, and fluids is reflected in the color, shape, coating of the tongue body. First step in examination of the tongue is to gain overall impression, specifically of vitality of the tongue. Okay? Now let's take up tongue vitality. Vital tongue has a fresh-looking body, well supplied with blood, giving it a fresh, pale red color. When tongue is full of vitality, it moves easily and can protrude from mouth without difficulty. The normal tongue should be a little moist, indicating presence of adequate fluids. Next is normal tongue color is pale red. The red coloration indicates that the qi and yang are strong enough to transport blood to the tongue. It also reflects the quality and quantity of the blood circulation in the body. The tongue has a pale tinge due to supply of fluids that are sent from the stomach to the tongue. Clear part of fluids serves the function of thinning the blood. If there is deficiency of fluids in the body, blood will be correspondingly less dilute. This will cause the tongue to appear redder. In a healthy person, pale red tongue body color arises from the appropriate mixture of blood and fluids. If a tongue is lighter than pale red, it is called pale. If it is darker than pale, it is red, cold, reddish, or red. Next, normal tongue body shape is neither too thick nor too thin. Tongue body should move easily and look neither too soft nor too stiff. Tongue surface should be smooth and soft and show no cracks. Size of tongue body corresponds to constitution of individual. Therefore, does not necessarily imply pathology. Tongue fits body shape of individual. A big, strong person normally has a big tongue body, while a thin, small person has a thin, smallish tongue. Okay? Next is normal tongue body shape is neither too thick nor too thin. Volume of tongue body is important. It should be neither too thin nor too thick. A slight tapering toward the tip of the tongue is normal. Tongue body shape reflects condition of a person in relation to their long-term energetic development. It can take years before a contracted or extremely swollen tongue body develops. Formation of cracks in the tongue body may also represent a lengthy pathological process. Next, normal tongue coating is white and thin. Thin white coating is regarded as normal, although it can also indicate acute, externally contracted wind cone. If the tongue shows no coating but is moist and of a normal color, this is also normal and does not suggest pathology. Slightly thick, pale yellow tongue coating at root of tongue arises from physiological activity of stomach qi during process of digestion. Fermentation of ingested liquids and solids results in steam, which materializes as turbid moisture on tongue coating. This coating is thickest at root of tongue and steadily thins out toward tip of the tongue. Due to turbidity rising up, it is normal for tongue coating at the root to be a pale yellow color. If there is coating in middle and anterior parts of the tongue, but none of the posterior, this is indicative of a condition characterized by deficiency. This so-called rootless coating originates most commonly from deficiency of stomach qi, stomach yin, and kidney yin. Next, veins underneath the tongue are not distended. So in the case of a normal tongue, sublingual veins are either barely visible or not visible at all. Their color should be light and not of a dark blue or purple color. When examining the veins underneath the tongue, particular attention should be paid to the following. The patient should curl the tongue up lightly and gently and rest the tip of the tongue on the palate. If the patient does not, if the patient does this more than once with a short space of time, the veins can become an intense bluish color. Similarly, if the patient has been talking a lot before the examination, the veins may also appear more bluish and distended. In such cases, the practitioner must be carefully in such cases, the practitioner must be careful in formulating a diagnosis of blood stasis based on the changed appearance of these veins. Now let's go to our patient, female, 25 years old. Her tongue description is pale, swollen, light yellow, and has greasy coating. Symptoms are loose stools without smell 3 to 4 times daily, abnormal distension, flatulence, and mood swings. Western diagnosis, none. Background to disease, irregular eating habits, excessive consumption of dairy foods, and unhappiness. PCM diagnosis, Phlegm deficiency with accumulation of dampness, food stagnation with accumulation of dampness in the middle air burner, which transforms into heat. Okay? Now, Phlegm deficiency with accumulation of dampness is reflected in a pale tongue body color and swollen body shape. Then, patient presented symptoms of loose stools without smell 3 to 4 times daily, resulting from irregular eating habits and excessive consumption of dairy foods. Next is food stagnation with accumulation of dampness in the middle burner with transforms into heat is presented in a light yellow, greasy coating of the tongue with presented symptoms of abdominal distension, flatulence, and mood swings resulted from unhappiness. Okay, thank you so much for listening.
Thank you very much, Ma'am Teresita. From tongue
Thank
diagnosis,
you din po, Dr.
we proceed to diagnosis by interrogation. Okay, and we are still on mental emotional symptoms. And this time, we continue with patterns of depression. The lack of movement of the ethereal soul, and hence, sa pag walang movement ng ethereal soul, there will be depression. This may be due to pathogenic factors that inhibit the ethereal soul, like liver qi stagnation, or to deficiency of liver, spleen, or kidneys, not stimulating the ethereal soul. The excessive movement of the ethereal soul and hence manic behavior may be due to pathogenic factors overstimulating the ethereal soul, such as fire or phlegm fire, or to the lack of anchoring of this soul from a deficiency of liver blood and or liver yin. Note that liver blood deficiency may lead to lack of movement of the ethereal soul when combined with liver qi deficiency. And liver qi deficiency is associated with gallbladder qi deficiency. Otherwise, liver blood deficiency fails to house the ethereal soul, so this will lead to excessive movement. When diagnosing the prevailing patterns in depressed patients, we have to differentiate between full and empty conditions. As the mood of depressed patients is the same in both cases, the main differentiating signs are the pulse and the tongue. In full conditions causing depression, pulse is wiry, slippery and wiry, whereas in empty conditions, choppy, short, or sad. As depression is often accompanied by anxiety, this is obviously more pronounced in full conditions. So we have here the figure showing us the patterns leading to excessive and deficient movement of the ethereal soul. So the first one, we have the normal state. No? So the ethereal soul or the hun comes and goes, and it is anchored in the liver. So nare-restrain siya. In the second one, the hun is not anchored in the liver, so there is too much coming and going of the hun. And the last one, the hun is too anchored naman, too restrained, too anchored in the liver. It does not come and go enough. Okay. So this will lead to deficient movement. So the main full patterns accompanying depression are liver qi stagnation, stagnant liver qi turning into heat, liver qi stagnation with qi phlegm, phlegm fire harassing the mind, blood stasis, and gallbladder heat. The main empty patterns accompanying depression are spleen and heart blood deficiency, heart yang deficiency, liver blood deficiency, kidney yin, and heart yin deficiency with empty heat, kidney yang deficiency. So if there is lack of movement of the ethereal soul, we have liver qi stagnation, liver blood and liver qi deficiency, spleen and kidney deficiency. So excessive movement of the ethereal soul, fire, phlegm fire, liver blood, and or liver yin deficiency. So to summarize depression, if you have liver qi stagnation, there is depression, moodiness, and irritability. Stagnant liver qi turning into heat, depression, irritability, and red tongue. Liver qi stagnation with qi phlegm, depression, moodiness, feeling of a lump in the throat. Phlegm fire harassing the mind. There is depression, anxiety, agitation, expectoration of phlegm, swollen tongue. Heart blood stasis, depression, agitation, purple tongue, gallbladder heat, depression, irritability, bitter taste, hypochondrial fullness, diaphragm heat, depression, anxiety, feeling of stuffiness in the chest following invasion of wind heat. Spleen and heart blood deficiency, depression, insomnia, palpitations, tiredness. Heart Yang deficiency, so may coldness, plus depression and palpitations. Liver blood deficiency, depression, lack of sense of direction, and sadness. Kidney and heart Yin deficiency with heart empty, heat, depression, anxiety, night sweating, palpitations, red tongue without coating. And finally, kidney Yang deficiency, depression, lack of motivation, lack of willpower, feeling cold, and frequent urination. So, ibig sabihin, with depression alone, you have to think of several patterns. So, exciting, di ba? Okay. Thank you very much. So, after a diagnosis by interrogation, let's proceed now to pulse diagnosis. Ma'am Mildred, good afternoon.
Yes po.
Ulit.
So pagpatuloy po natin ang ating pulse diagnosis, the normal or healthy pulse, number 2 po. So the position of the patient arm is important. Sabi nga natin, dapat hindi mataas sa puso yung pagkakapwesto ng kamay. Gravity will cause the blood to flow downwards and away from the wrist. This will make the pulse felt weaker than it really is. So, kasi mababago po yung yung pulse pag hindi siya naka-level or mas mataas sa ating puso. Pay close attention to whereabouts on the fingertips you are feeling the pulse. If the pulse position is weak and thin, and the position next to it is strong and replete, you can risk misinterpreting the sensation in the fingertips. So this is similar to the way that a loud radio can drown out the sound coming out of the radio closer by that is turned down low. So yun po yung maapektuhan po siya, no? Eh dapat fingertips po yung ating papakiramdam. Remember to ask the patient if they are taking medication for blood pressure, heart medication, blood thinners, antidepressant, and etc. Dahil po yun will corrupt the pulse image. Sabi nga nababago po yung pulse kung umiinom ang pasyente nitong mga gamot na ito. Factor that can interfere with the pulse diagnosis. Una po yung a person is stressed, just run, cycle, or walk quickly. So ang epekto nito, mag-generate ng heat and makes the pulse rate increase in speed and strength. Yan, pagod. So kung stress naman po ang effect, pwedeng mag-stagnate yung liver qi at magpuproduce po ng watery pulse. So stress can also generate heat. So kaya dapat nakarelax yung pasyente. Kung natatakot naman po siya, may nervousness, siyempre unsettles the shen and spreads the heart qi. Kung may medication, magiging blurs and complicates the pulse image. Kung arm is higher than heart, the pulse will be weaker. So, katamtaman po, ka-level lang ng heart niya yung kanyang kamay, the arms. Several other factors must also be taken into account. These factors are natural differences or changes that are normal and to be expected. It is only when the person's pulse differs from what we expect to feel that it is defined as being pathological. So, yun po yung mga mahalagang tinatandaan pag tayo nagpupulso. The pulse, like many other things, manifests the fluctuation of yin and yang throughout the year. Summer is the most yang time of the year. So, the pulse should be more yang in nature. Halimbawa ngayon, tag-init. So, mas yang yung mga pulse na nakukuha ngayon. It will be more superficial and overflowing. The young heart of summer can increase the pulse rate, so it is faster. Pag winter naman, the most chill time of the year, when everything is drawn inward and become quiet air. Sa atin po yung ano natin taglamig, pag nagdi-December, September po ano. So mas maraming pulse diyan ay nagiging slow. The pulse in winter should therefore be deeper. Spring is yang. It is the wood pace. This can be felt in the pulse, which should gain a slight, wiry quality in the spring. In the autumn naman po, the pulse should become softer because yang is decreasing and yin is increasing. Wala naman sa ating autumn sa ibang bansa to. This means that if a pulse is superficial and flooding in the winter, it is more serious sign that if this sensation is felt in the pulse in the summer. Okay. People whose occupation involves hard physical work should have a stronger pulse than someone who works in the office. Siyempre, mas malakas yung kung halimbawa yung mga laborer kaysa dun sa mga nag-o-office. So therefore, it will be more serious sign if a man who works as a builder has a deficient pulse than it would in a woman who works as secretary. So pag mas mahina yung mga laborer natin, talagang sign na po yun na may disease. People who regularly play a lot of sport, physically train or work out will often have a slower pulse. Children have faster pulse and the pulse rate decreases with age. So it will therefore be a more significant sign of heat when a 50-year-old marathon runner has a pulse rate of 80 beats per minute than if it is a 10-year-old child. However, it is not necessarily a healthy sign if a person who is very physically active with a hard training program has a slow resting pulse. The physical exertion of training and sport can damage their yang qi, which is why their pulse rate is slow. So yun po yung dahilan. The person's body build will also have an influence. Yung mga matatabang tao po, ang pulse niyan ay deeper than a thin person whose pulse will be more superficial. So mas madali pong mahanap sa thin person. In the week before menstruation, the pulse has more of the slippery quality. Sa mga babae naman po yun ano. So in the week after menstruation, pagkatapos po ng mens, mas nagiging weaker ang mga pulse ng babae because the woman is relatively deficient of the blood, swesu, at this time. Kasi nga nag-mens, lumabas yung mga dugo. Kaya mas nagiging weaker po yung pulse. Okay. The pulse is more slippery during pregnancy. Yon, pag buntes, slippery po yung nakakapa. So if the pulse become choppy during the pregnancy, so negative sign po yun. Maaari daw po siyang makunan. Sign of miscarriage. So pag nagcha-choppy. If the person is tired or has sleep properly, the pulse will be weaker. So if the person has just eaten, the pulse can be affected in 2 ways. Yung pulso maaaring be fuller and slippery in right guan. Kasi ano ba yung nasa right guan natin? Spleen. Mararamdaman natin yung spleen and stomach. Because there is an accumulation of food and qi in the stomach. So nagtatrabaho siya. Or it may be weaker in this position. Pwede rin dahil yung spleen qi ay burdened by having to transform the meal. So pwedeng humina kasi nga nagtatrabaho siya. The qi producing organs pulses are felt on the right wrist. So pag right naman po, 'di ba, yung lung, spleen and kidney. The left hand pulse includes the organ that are root of the blood, the store and govern the blood. So kasi po yung right natin ay ang lung, spleen, kidney. Baliktad pa rin sinabi ko kanina. So this means the right hand pulse will reflect the condition of qi and the left the state of blood. So yung left pulse natin, andyan yung heart, liver, and kidney. Kidney yin. So natural variation and pulse. So yung factor po doon, pag season, sa ibang bansa po ito doon, hindi sa atin. Sa atin kasi ano lang, wala tayong spring. So pag spring po, more wiry ang nakukuhang pulse. Pag summer, more superficial and flooding. Pag autumn, mas softer. Pag winter, deeper. Sa gender naman po, sa lalaki, strong pulse than women. Stronger in the left and tune position. So yung left natin ay, pag sa tune position, yung heart. Pag women naman, weaker pulse than men's. Stronger in the right. So ang right po ay position in the chi. So yung kidney, sa kidney yang, mas malakas sa babae. Sa lalaki naman, yung left tune, yung heart. So the person's profession, physical work, stronger pulse. Yung talagang nag-exert sila ng mga energy. Pag sedentary work po, ang pulse niyan ay weaker. So individual who physically train a lot, magiging pong slower pulse sila. So yung mga dapat i-consider pag tayo nagpa-pulse. Ito. Age and speed. So pag pag 1 to 4, ang pulse pong nakakapa ay 90 beats per minute. Per minute po bibilangin. Pag nagpa-pulse po tayo pala, hindi pinapahalata sa pasyente kasi minsan pag nag-pulse tayo na halata nila, nagkakaroon sila ng ibang reaksyon. Kaya hawakan mo lang po ng tahimik. So pag 4 to 10 age po niya, 80 per minute. Pag 10 to 16, 78 hanggang 80 po per minute. Pag 16 to 35, 76 per minute. 35 to 50, 72 to 70 per minute. Pag 50 plus na po ang age, nagiging mas mabagal, 68 na lang. So, yung body build naman po, pag matataba, heavy set or obese, so generally deeper po ang makukuha natin. Kasi syempre pag hawak mo pa lang dun sa kamay nila mataba, talagang parang taba mo na yung mahawakan mo kaya wala ka pang mararamdaman na pulse. Kailangan mo idiin para maramdaman. Pag thin body po, syempre halos balat na lang yan mapapayat. So mas generally superficial. Pag tinapat mo na yung kamay mo, mararamdaman mo na. Pag nagme-mens naman, the week up to menstruation, ito po yung summary nung sinabi natin kanina, the pulse is more slippery. So a week after menstruation, the pulse is weaker. So pag buntis, the pulse become more slippery during pregnancy. Pag fatigue or lack of sleep po, the pulse will be weaker. The person has just eaten, the pulse can be stronger and sleepier or weaker. So yun po yung guide natin. Napakaganda po. Madali nang maintindihan. Salamat po. Naway may natutunan tayo.
Of course, madami, no? So it's always good to review because there might be things that we have left out, no? Maraming salamat po, Ma'am Mildred. Let's continue with the differential diagnosis. Let's welcome Ma'am Neets Yu. Good afternoon, Ma'am Neets.
Good afternoon, Doc Hector, and good afternoon, everyone. How's my audio, Doc?
Yeah, it's okay po. Clear.
Welcome to our TCM Foundations number 189. Andito pa rin tayo sa lung patterns, okay? Lung Yang Deficiency. Okay. So, etiology, hereditary weakness, poor posture, which constricts the breath, paghinga, okay? Exposure to cold, prolonged grief and sadness, weakening the lung qi. Repeated impairment of lung qi, diffusing and descending function over a long time, spleen and kidney yang deficiency. Okay? Sign and symptoms, shortness of breath, panting, worse on exertion, forceless cough with profuse, watery sputum, weak voice, bright white complexion, spontaneous daytime sweating, dislike of speaking, easily catches colds, tiredness, dislike of food, feeling of cold hands, cold feeling of upper back, absence of tears, hindi nauuhaw, okay? When you palpate the pulse, it is weak, especially right front position. Okay. Yung tongue, kapag tinignan nyo ay pale, slightly wet, and white fur or may white coating. Okay? Treatment principle, warm and supplement Lung Yang. Acupuncture treatment points po, Lung 9, supplements Lung Yang, REN 6 or CV6, supplements original Qi, fortifies Yang, GV12 or DU12, relieves cough and dyspnea. REN 12 or CV12 is supplements earth to strengthen the metal. Okay. Bladder 20 supplements the spleen. Okay. Lung 7 promotes descending of lung qi. Bladder 13 supplements lung qi. Stomach 36 supplements stomach and lung qi. Bladder 43 supplements the lung. Spleen 3 source point of the spleen. Okay. Needle technique is with supplementation, and you can use large amounts of moxa kasi deficiency. Okay, thank you very much. I hope you learn from
Yeah,
here.
thank you very much, Ma'am Needs. Thank you so much. Okay, from differential diagnosis, we will proceed now to acupuncture patterns and practice. And we have a new topic, constipation. Let's now listen to Ma'am Teresita Sumile. Good afternoon po, Ma'am Teresita.
Good afternoon ulit, Dr. Hector and classmates. Welcome po sa acupuncture patterns and practice. Tapos na po tayo sa dysentery. Now let's talk about constipation. Constipation means either feces remaining over long in the large intestine so that the interval between defecations is prolonged, or difficult or painful defecation due to dry, large, or hard feces. Okay? Now, etiology and pathology. Constipation results principally from the large intestine losing its function of transmission. So there are 4 groups of causes. The first cause is heat-induced constipation. The first group of causes includes mainly intemperate diet. This may be excessive intake of alcohol drinks, overindulgence in acrid, spicy, or rich foods, or intake of wrong or poisonous medicinal herbs. Any of these can induce the accumulation of heat in the stomach and the intestines and injure the body fluids. This in turn leads to dehydration and impedance of intestinal tract, resulting in heat-induced constipation. In addition, residual heat from an illness of exogenous heat or downward transmission of dryness heat from the lung to the large intestine can also lead to this type of constipation. Next group of causes is impaired qi movement. Excessive melancholy or brooding, insufficient physical activity or overactive wood element, especially liver, suppressing the earth element, most especially spleen, can each lead to impedance in the movement of large intestine qi. This in turn leads to loss of the functions of descending and downward transmission, so that chyme dwells over long in the large intestine and turns into qi-induced constipation. Furthermore, constipation of qi can transform into fire, and accumulated fire can injure the body fluids. This leads to the drying of feces and difficulty with defecation. Next cause is qi, yin, or body fluid deficiency. A variety of conditions can lead to deficiency of qi or body fluids. They include convulsions from a severe illness, having given birth and a weak constitution in the elderly. Excessive use of herbs that induce diaphoresis or catharsis or that dry dampness can injure yin fluids. Excessive physical activity, excessive sweating, or indulgence in sexual activity can injure qi, blood, and yin essence. Diabetes can lead to depletion of yin fluids. In all these conditions, there is loss of motive force for the large intestine and the intestinal tract becomes dehydrated. Deficiency-induced constipation ensues. The last cause of constipation is deficiency of yang qi. Routine overeating of cold and raw foods of excessive use of bitter and cold herbs can injure yang qi. In sense of weak constitution, genuine yang is deficient. If yang qi of the spleen and the kidney is deficient, it can no longer warm the body fluids or to moisten the intestinal tract. As a result, yin cold gels in the interior, causing blockage in the intestines and impedance of the movement of chyme. This is called induced constipation. Although constipation is primarily due to the large intestine losing its transmission function, it is intimately related to the functions of other visceral organs, especially the lung, the spleen, and the kidney. The lung and the large intestine are related as an interior-exterior dyad. Heat or dryness in the lungs easily extends or transmits to the large intestine. The spleen governs transformation and transportation. Disturbance of these functions leads to stagnation of chyme. The kidney governs the fluids and controls urination and defecation. Deficiency of kidney essence leads to dehydration of the intestinal tract. Insufficiency of kidney yang and decline of the fire of the vital gate conduce to the gelling of yin cold and loss of intestinal transmission. All this can lead to constipation, okay? Now let's go to clinical manifestation. Constipation is often manifested as a decreased frequency of defecation, that is, longer intervals between successive defecation. In most cases, the frequency is once every 3 to 5 days or every 5 to 7 days. Occasionally, defecation may not come even after half a month, but this is uncommon. Some patients may defecate at a normal frequency, but their feces are very dry and the defecation is difficult or painful. Sometimes the feces may not even be dry or hard, but because the deficiency of qi and blood, the patient does not have strength to expel the feces or to evacuate completely, okay? Now, because constipation causes turbid qi to fail to descend, abdominal distension may result. There may be abdominal pain, dizziness, distending headache, epigastric discomfort, eructation, anorexia, restless sleep or agitation, and irascibility. When constipation is protracted, there may be palpable sausage like masses in the left lower abdomen. These are masses of accumulated feces. They disappear or decrease following defecation. In general, even when defecation occurs every 2 or 3 days and the Tests are dry. If there is no difficulty or pain and there is no other symptom, the physician should not diagnose constipation. Okay? Yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. Okay, from constipation, we proceed to symptoms and signs. Okay, our topic is swollen lips and inverted lips. Swollen lips. So the first thing that one has to consider is toxic heat affecting the stomach and spleen. Swollen dark lips, thirst, feeling of heat, mental restlessness, pustular rashes, swelling, pain, headache. Then the tongue is red with red points and thick, sticky yellow coating. Pulse is overflowing, slippery, rapid. Another consideration for swollen lips would be damp heat in the stomach and spleen. Swollen and bright red lips, feeling of fullness and pain of the epigastrium and lower abdomen, poor appetite, feeling of heaviness, thirst without a desire to drink, nausea, loose stools with offensive odor, feeling of heat, dull yellow complexion, sticky taste, red tongue with sticky yellow coating, slippery rapid pulse. Another consideration for swollen lips is wind heat in the skin. Swollen and bright red lips with acute onset, urticarial rash, swelling of the throat, itching, red eyes. This corresponds to an allergic reaction to foods or to a bee sting. Now let's go to inverted lips. First is severe yang deficiency. So there will be cold limbs, sweating, feeling cold, lassitude, backache, dizziness, tinnitus, loose stools, pale and wet tongue, deep, weak, or scattered pulse. Other symptoms and signs depend on the organ involved. And finally, we can also consider severe yang deficiency. Inverted lips, feeling of heat, dry skin, dry mouth, dry nails, dizziness, tinnitus, night sweating, tongue without coating, fine or minute pulse. Other symptoms and signs depend on the organ involved. Thank you very much. And now we proceed to the last but not the least topic, atrophy syndrome. And let's welcome again Ma'am Mildred Tigma. Good afternoon po
Hello po.
ulit, Ma'am Mildred.
Good afternoon po muli. Magpapatuloy po natin ang ating topic, atrophy syndrome. Identification of patterns and ano po yung doc? Okay. Tingnan po natin yung patterns and treatment po ito. Stomach and spleen deficiency. So, ang clinical manifestation po nito, may muscular weakness. So, nanghihina. A feeling of weakness of the limbs, tiredness, easily fatigue, poor appetite, loose stool, and sallow complexion. So, ang tongue po niya ay pale, ang pulse ay weak. Deficient, kaya ganun. So, this pattern appears in the middle-late stage of atrophy syndrome. And it may develop from 1 to 2 previous patterns, those characterized by dampness. So sa ganitong mga case, ang condition po ay will be one of the emptiness of the stomach and spleen. With fullness, dampness, and the treatment need to be suitably adapted so that it will simultaneously tonify the stomach and spleen and resolve dampness. So yung palalakasin po natin yung spleen para mawala yung mga damp. So it should be remembered that the pattern of spleen Qi deficiency is very often combined with that of either damp heat or damp cold or cold dampness. One has to assess whether the condition is primarily full or empty and choose the prescription accordingly to resolve dampness or tonify. So kailangan ma-identify po natin kung full or deficient. So stomach and spleen, That chosen prescription should then be modified with herbs to tonify the spleen or resolve dampness respectively. So treatment principle po dyan, tonify stomach and spleen, strengthen the muscles. If necessary, resolve dampness. Pag stomach and spleen deficiency naman po, ang mga points na gagamitin ay stomach 36. Third point po yan, magpapalakas. Spleen 3, bladder 20, bladder 21, REN 12. So reinforcing method po. Moxa is applicable. So stomach 36, spleen 3, bladder 20, bladder 21, REN 12. Nagtotonify po yan sa spleen at saka stomach. Okay? Pag spleen and heart po ay collapse, ang clinical manifestation po niyan, may muscular weakness of sudden onset. After a shock, may palpitation, insomnia, poor appetite, with white complexion, tapos loose po yung stool. So, syempre po, ang tongue yan ay pale. Ang pulso, mahina po siya, slightly floating empty. It could also be moving. So, yung condition na pong ito ay occurring after a shock that depletes the heart and spleen suddenly. So, sa karanasan daw po nitong author, the situation is not usually enough to cause atrophy syndrome by itself. Rather, it is often the trigger for the development of atrophy syndrome. So, yung treatment principle po dito ay itonify mo yung spleen and heart qi and nourish blood. So, pag spleen and heart naman po ang collapse, yung points po natin gagamitin ay do 14, heart 5, heart 7, bladder 15, bladder 20, stomach 36, spleen 6, and REN 4. So, reinforcing method din po, moxa as applicable. Then, explanation po ng mga points, ang do 14 po, with direct moxa, nagtutonify po yan ng heart. Ang heart 5, heart 7, and bladder 15, tonify heart qi and blood, and calm the mind. Bladder 20, stomach 36, and spleen 6, tonify po ang spleen, stomach, spleen, and nourish blood. Ang REN 4 naman, nourishes blood and calms the mind. Pag liver and kidney yin deficient naman po, yung clinical manifestation nito, so weakness and atrophy of leg muscles. So mayroon pong sore back, then nahihilo, may tinnitus, nagkakaroon ng blurred vision, nanunuyo ang mata, dribbling of urine, then exhaustion. Kung titingnan po natin yung tongue, without coating po yan. Tapos yung pulse niya ay fine and deep. So this consists of deficiency of yin of the liver and kidneys, and weakness and malnourishment of sinew and bones. So yung pattern na po to only appear at the late stage of atrophy syndrome. And the symptoms and sign develops gradually. So dahan-dahan po yan, hindi naman biglaan. It may also develop from any of the above patterns in their late stage. So yung treatment principle po natin, kailangan nating in-nourish yung liver and kidney, strengthen sinews and bones. Liver and kidney yin deficiency, pag yun naman po ang nag-combine. So yun yung po yung points natin na gagamitin, bladder 18. Siyempre, baksyo yan ng liver. Bladder 23, baksyo ng kidney. Then kidney 3, liver 8, do 3, gallbladder 34, gallbladder 39, and REN 4. So reinforcing method po yung gagamitin. Although there is yin deficiency, a small amount of moxa on the needle may be used on certain points. The general one for the channels indicate above, provided that there are no empty heat. So, dapat walang empty heat kung magmamoksa. So, yung bladder 18 po, bladder 23, kidney 3, and liver 8, nagtotonify po yan ng liver at saka kidney. Yung do 30, tonifies the kidney and stimulate the circulation of qi and blood to the legs. Ang gallbladder 34 po and gallbladder 39, nagnonourish po siya ng sinews and bone marrow, respectively. REN 4, nagtotonifies ng kidney yin. Pag may blood stasis naman sa channels, clinical manifestation po. So may pamamanhid, weakness and pain in the limbs, withered lips. Yan, makikita na natin yung bluish color of limbs. Pain on flexion of limbs. So bluish kasi may stasis. So yung dila po purple. Yung pulse, deep, fine, and choppy. So yung pattern pong to appears in the latest states of atrophy syndrome. And it's the only one characterized by pain. So stasis, kaya masakit po yan. It is often associated with the previous pattern of liver and kidney deficiency. So yung treatment principle po, nourish and invigorate blood and eliminate stasis. So yung points po natin, syempre yung bladder 17, special point for the blood. Spleen 10, bladder 11, do 9, do 8, stomach 36, spleen 6. So even method po on all except on stomach 36 and spleen 6 should be reinforced. So yung bladder 17 is spleen 10, invigorate blood and eliminate stasis. Bladder 11, nourish blood. Do 9, do 8, relax the sinews. Stomach 36, spleen 6, nourish blood. Thank you po. Yun, may sasaulo na tayong mga points.
Okay, so ang daming patterns, no? Anyway, thank you very much, Ma'am Mildred, and we hope that everybody learned a lot from today's session. Any questions before we go? So if there are none, we would like to thank everyone for joining, especially the presenters, and see you po next week. Thank you very much.
Thank you din po, Dr. Hector.
Thank you po.
Thank you.